Which gland's activity is disrupted by artificial light and reduced sleep? Pineal gland. The pineal gland secretes melatonin, which regulates the sleep-wake cycle. Exposure to artificial light and lack of sleep can suppress melatonin production, disrupting this rhythm. Calcitonin primarily functions to inhibit bone resorption. Calcitonin, secreted by the thyroid gland, lowers blood calcium levels by inhibiting bone resorption and promoting calcium excretion through kidneys. Which of the following is an amino acid-derived hormone? Epinephrine. Epinephrine is derived from the amino acid tyrosine. It is a catecholamine and plays a major role in the fight-or-flight response. Which is a temporary endocrine gland in the human body? Corpus luteum. Corpus luteum forms after ovulation in the ovary and temporarily secretes progesterone and estrogen to maintain early pregnancy. Gonadotropin-releasing hormone from the hypothalamus stimulates anterior pituitary, triggering LH and FSH. GnRH targets the anterior pituitary, triggering the release of follicle-stimulating hormone and luteinizing hormone, both essential for reproduction. Why doesn't GH hypersecretion in adults increase height? Epiphyseal plates close after adolescence. After adolescence, epiphyseal plates fuse, stopping further longitudinal bone growth, so excess growth hormone leads to acromegaly, not increased height. Which action is primarily regulated by parathormone? Calcium release and uptake. Parathormone, secreted by the parathyroid glands, increases blood calcium by releasing it from bones, reabsorbing it in kidneys and activating vitamin D for better absorption from the gut. What is the primary function of insulin in the human body? Promotion of glucose uptake by cells. Insulin, secreted by pancreatic beta cells, helps lower blood sugar by promoting glucose uptake into cells, especially muscle and fat tissues. It also inhibits gluconeogenesis and lipolysis. What is the primary function of aldosterone in the body? Sodium reabsorption in the kidneys. Aldosterone secreted by the adrenal cortex acts on the distal convoluted tubule. Its main function is to increase sodium reabsorption and potassium excretion, helping maintain blood pressure. The primary role of relaxin during pregnancy is to relax pelvic ligaments. Relaxin is secreted mainly by the ovaries and placenta during pregnancy. It helps relax the ligaments of the pelvis and softens the cervix to facilitate childbirth. Changes in GnRH pulse frequency in females is controlled by circulating levels of estrogen and progesterone. GnRH stimulates the pituitary to release FSH and LH. Low-frequency pulses trigger FSH, while high-frequency pulses promote LH, regulated by estrogen and progesterone feedback. Which of the following hormones is not involved in glucose metabolism? Aldosterone. Aldosterone primarily regulates sodium and water balance and has no direct role in glucose metabolism. Which hormone is synthesized elsewhere but stored and released by the pituitary gland? Antidiuretic hormone. Antidiuretic hormone is synthesized in the hypothalamus but stored and released by the posterior pituitary. The other hormones listed are produced and secreted by the anterior pituitary itself. A pregnant woman delivers a baby with stunted growth, low IQ, and abnormal skin. What is the likely cause? Deficiency of iodine in diet. Iodine deficiency during pregnancy can lead to congenital hypothyroidism in the baby, causing stunted growth, mental retardation, and abnormal skin. Which chemical transmits nerve impulses across a synapse? Acetylcholine. Acetylcholine is a neurotransmitter released at synaptic junctions, especially at neuromuscular junctions, to transmit nerve impulses. Resting membrane potential is mainly maintained by sodium-potassium ATPase pump. The sodium-potassium pump actively exports 3 sodium ions and imports 2 potassium ions using ATP, creating a net negative charge inside the cell, which is essential for maintaining the resting membrane potential. Destruction of the anterior horn cells of the spinal cord would result in loss of voluntary motor activity. The anterior horn of the spinal cord are lower motor neurons that control voluntary skeletal muscles. Their damage causes loss of voluntary movement. The human hindbrain comprises 3 parts, one of which is medulla oblongata. The hindbrain includes the pons, cerebellum, and medulla oblongata, which control vital functions like breathing, balance, and coordination. The nerve centers which control body temperature and the urge for eating are contained in hypothalamus. The hypothalamus regulates homeostasis, including body temperature, hunger, thirst, and other autonomic functions. One of the examples of the action of the autonomic nervous system is pupillary constriction. Pupillary constriction is controlled by the parasympathetic division of the autonomic nervous system, which regulates involuntary functions such as heart rate, digestion, and pupil size in response to light. Injury to the vagus nerve in humans is likely to affect voice and heart rate. The vagus nerve innervates the larynx and parasympathetic control of the heart, lungs, and digestive organs. Injury can impair speech and disrupt heart rate regulation. The Nissel's granules of nerve cells are made up of ribosomes and rough ER. Nissel's granules are dense structures in the cytoplasm of neurons, composed of ribosomes attached to rough ER, involved in protein synthesis. Respiratory center is situated in medulla oblongata. The respiratory center located in the medulla oblongata regulates the rate and depth of breathing by controlling the contraction of respiratory muscles. Afferent nerve fibers carry impulses from sense organs to CNS. Afferent fibers are sensory neurons that transmit impulses from receptor to the central nervous system for interpretation. Ribs are attached to thoracic vertebrae and sternum. Ribs are dorsally attached to the thoracic vertebrae and ventrally to the sternum, forming the rib cage that protects thoracic organs. What is the type of movable joint present between the atlas and axis? Pivot joint. The joint between the atlas and axis is a pivot joint, allowing rotation of the head from side to side. ATPase of the muscle is located in myosin head. The ATPase enzyme is present in the head of the myosin filament. It hydrolyzes ATP to release energy required for muscle contraction. Intervertebral disc is found in the vertebral column of mammals only. Intervertebral discs are cartilaginous pads found between the vertebrae of mammals. They act as shock absorbers and allow flexibility of the spine. Knee joint and elbow joints are examples of hinge joints. Knee and elbow joints are hinge joints which allow movement in one plane only, enabling flexion and extension. Macrophages and leukocytes exhibit amoeboid movement. Macrophages and certain leukocytes move using amoeboid movement, where they form pseudopodia to crawl through tissues during immune responses. Which one of the following is not a disorder of bone? Atherosclerosis. Atherosclerosis is a cardiovascular disorder involving the buildup of fatty plaques in arteries. The other options are all disorders affecting bones or joints. Lack of relaxation between successive stimuli in sustained muscle contraction is known as tetanus. Tetanus is a condition where repeated stimuli prevent muscle relaxation, causing a sustained contraction. It results from high-frequency nerve impulses. Which of the following joints would allow no movement? Fibrous joint. Fibrous joints are immovable joints where bones are tightly joined by dense connective tissue. The other joints listed are synovial and allow various degrees of movement. The joint found between the sternum and the ribs in humans is cartilaginous joint. The sternocostal joints are mostly cartilaginous joints, allowing limited movement to aid in breathing. They connect ribs to the sternum via costal cartilage. Which of the following is the least toxic excretory product in animals? Uric acid. Uric acid is the least toxic and requires minimal water for excretion. Ammonia is highly toxic and needs a lot of water, while urea is moderately toxic. Filtration of blood in the nephron occurs at the glomerulus. Blood filtration occurs in the glomerulus, a tuft of capillaries inside the Bowman's capsule. High pressure in the glomerulus forces water, ions, and small molecules into the capsule, forming the filtrate. The pH of human urine is approximately 6. Normal human urine is slightly acidic, with an average pH of about 6. This helps in preventing bacterial growth and maintaining the acid-base balance. The condition of accumulation of urea in the blood is termed as uremia. Uremia is a serious condition where urea accumulates in the blood due to kidney failure or impaired renal function. It indicates that the kidneys are unable to excrete nitrogenous wastes properly. Which one of the following is also known as antidiuretic hormone? Vasopressin. Vasopressin, also called antidiuretic hormone, is secreted by the posterior pituitary. It promotes water reabsorption in the kidneys, reducing urine output and helping maintain blood pressure and fluid balance. Dialyzing unit contains a fluid which is almost same as plasma except that it has no nitrogenous wastes. The dialyzing fluid mimics blood plasma in composition but lacks nitrogenous wastes like urea and creatinine. This concentration gradient allows waste to diffuse out of the patient's blood during dialysis. The process by which urine is expelled from the urinary bladder is known as micturition. Micturition is the process of expelling urine from the urinary bladder through the urethra. It is a reflex controlled by the central nervous system. Which part of nephron helps concentrate urine via countercurrent mechanism? Loop of Henle. The loop of Henle creates a countercurrent mechanism that helps in concentrating urine by maintaining a gradient in the medullary interstitium. The average amount of urea excreted per day by a healthy adult human is 25 to 30 grams. A healthy adult typically excretes 25 to 30 grams of urea per day, which is the main nitrogenous waste produced during amino acid metabolism. Which of the following types of cells lack a nucleus? Erythrocytes. Mature human erythrocytes lack a nucleus to provide more space for hemoglobin, enhancing oxygen transport. Other white blood cells listed contain nuclei. Which one of the following blood cells is involved in antibody production? B lymphocytes. B lymphocytes produce antibodies as part of the adaptive immune response. When activated, they differentiate into plasma cells, which secrete specific antibodies to neutralize pathogens. Which of the following cells do not exhibit phagocytotic activity? Basophils. Basophils are involved in inflammatory and allergic responses, releasing histamine and other mediators. Unlike neutrophils, monocytes, and macrophages, they do not perform phagocytosis. Erythropoiesis starts in yolk sac. Erythropoiesis begins in the yolk sac during early embryonic development. Later, it shifts to the liver and spleen between the 3rd and 6th months of fetal life. After the 6th month, the bone marrow becomes the primary site of erythropoiesis. Thrombin directly converts which plasma protein during clot formation? Fibrinogen. Thrombin converts fibrinogen into fibrin, which forms the mesh of the blood clot. Factor X and factor 13 are involved in the clotting cascade, but not directly converted by thrombin. Which human organ is often called the graveyard of RBCs? Spleen. The spleen filters blood and removes old red blood cells. Macrophages in the spleen digest these RBCs, recycling iron and clearing debris, which is why it's called the graveyard of RBCs. Which of the following primarily secretes histamine during allergic reactions? Mast cells. Mast cells are tissue-resident immune cells that store and release large amounts of histamine during allergic and inflammatory responses. Thanks for watching, and subscribe now for daily biology MCQs.